Type 2 diabetes is the leading cause of death for communicable diseases in South Africa. The 5-year mortality rate after a diabetic foot amputation is higher than 40% globally. Thus, healthcare services are obliged to prevent amputations. In KwaZulu-Natal, we have 2,500 diabetic foot amputations every year with a cost of more than 300,000 Rand per amputation. Most lower limb amputations are preventable. This indicates inadequate care within the healthcare services. The risk for lower leg amputations among individuals with poorly controlled type 2 diabetes is 44% higher with every percentage that the HbA1c increases. Poverty, literacy, and other environmental barriers complicate diabetic foot care in rural areas. And there is a lack of awareness for the need of foot care among healthcare providers, patients, as well as relatives. And few professionals have the interest and training in diabetic foot care. Training programs are not available either. Only 7.8% of patients with diabetes undergo foot examinations within KwaZulu-Natal, which is a province in South Africa, while 90% are not even educated about foot care. Proper foot care and strict glycemic control prevents foot ulcers, and where education plays a key role. At one of the hospitals, which is a public hospitals, Grace Hospitals, 9% of patients that presented with foot sepsis were newly diagnosed with diabetes, meaning that education about foot care is vital from diagnosis. Person-centeredness and caring can improve this dire situation. In Afrikaans, we have the word omgee, which means to care about someone, not just for someone, or not just care for. Caring is the careful attention to every single unique patient with interest, curiosity, concern, and openness for what moves or puzzles the patient, and then rightly responding to it. Leininger suggests that although caring is universal, it depends on the culture. In the caring moment, the nurse needs to be open, sensitive, and communicative. And they need to show confidence, courage, professionalism, respect, and support the dignity of the patient. The nurse must have a caring attitude, empathy, and warmth. They must be truly present, which is the participation, involvement of sharing and feelings and experiences. Person-centered care focuses on working with the patient's beliefs, values, and engagement, and having a sympathetic presence, and shared decision-making by providing holistic care. It is enabled by cultures of empowerment, and the people-centered framework of the World Health Organization calls for health systems that are designed around the needs of people. So person-centeredness, patient-centered, client-centered, and individualized care are all interchangeable terms. But in this study, person-centeredness was used as it places the individual at the center of the healthcare system, where they play a more active role in their own health. The objectives of the study was to describe registered nurses' experience of person-centered caring in managing the foot care of patients with type 2 diabetes, to explore current practices of registered nurses regarding the foot care of patients with type 2 diabetes. It was a mixed method convergent design study, and the rural district of the King Cetshwayo district was stratified into 5 different municipalities, and during the qualitative strand, 18 semi-structured interviews were conducted with the registered nurses working at in-town rural clinics as well as out-of-town rural clinics. And a total of 15 clinics were selected. So the qualitative content analysis was done to analyze the semi-structured interviews. The qualitative data analysis was primarily done deductively, but new themes were also allowed to emerge from the qualitative data because purely deductive method can limit innovation. The categories were counted to identify the most that were most important, and the themes that relate to the caring that were looked for was based on the conceptual framework of Roach 2002, which included the following concepts: confidence, competence, commitment, conscience, and compassion. These concepts were used to evaluate caring in the quantitative surveys with the patients with type 2 diabetes. And the person-centered concepts that were looked at were autonomous patient participation with care based on the patient's individual and physical and emotional needs, the relationship between the patient and the healthcare professional, the skills, knowledge, and cooperation as a cohesive health professional team, and the last aspect of the context of care, which included barriers to person-centered caring, access to healthcare, supportive organizational systems, and the therapeutic environment. So what was the findings? So the primary finding that came out of the qualitative strand was that the nurses felt that they were nursing the queues. And this led to a vicious cycle of nurses neglecting the patients neglecting themselves, and then the patients end up not attending the clinics and sending their relatives to fetch their medication. So the nurses said that the only thing that they were doing is they were rushing to push the queues so that people can go home. So nursing care is neglected. They said that it's non-focused and that the communication with the patients is not what it seems, because they would say that the communication is good with the patients, but then 3 minutes later they would say, but they don't listen to us. So then the clinics are short, public healthcare clinics are short-staffed, the nurses are overwhelmed, there's a lack of time to give proper care, and there's a lack of support from the multidisciplinary team. In other words, there is no time or space or support for any person-centered caring to take place. There's a non-conducive environment in these clinics. There's a lack of functional equipment and a lack of space and privacy for examinations. And then they also reported inadequate training. They have a lack of knowledge in diabetic food care as well as diet, and they don't understand the term person-centeredness or caring. This led to patients with diabetes being neglected. First, they are neglected by the nurses. So the nurses end up just dishing out medication. There's no space. There's no diabetic foot examinations that are taking place. And there's also a lack of health education in diabetes and diabetic foot care. So the patients end up with a lack of knowledge about their own foot care as well as about diabetes. And then the patients end up neglecting themselves. They have a non-compliant diabetic diet. They don't do any exercise, lack of exercise. Then there's non-compliant self-management. So they also don't take care of their feet by themselves. One nurse reported that the patients are dying while walking because they wait until the last minute, until the situation is really bad before they report any foot sores, and then they end up being hospitalized and probably with an amputation. Okay, the next thing is that the patients don't attend the clinics anymore because of three things. They send relatives to say to go and collect their medication from the clinics, and the patients are poor. There's a huge amount of poverty. They are obese and they are elderly, which makes it difficult to get to the clinics. They are also traditionally isiZulu, so they end up using going to traditional healers. They are illiterate, and illiteracy contributes to diabetic foot ulcers and because of the lack of self-management and uncontrolled diabetes. And then there's also a mistrust in the public health system. Sorry about this. So there's a mistrust in the public health system. There's a lack of trust in the treatment that they get from the clinics because of the fact that medication might end up having the same generic names, but they end up having different trade names, and the patients don't necessarily understand that. And then patients don't go to the hospitals when they are referred because they are scared that they will go to the hospitals and they will end up with an amputation afterwards. Okay, so the recommendations and conclusion. There is a need for an in-service training program that considers the district's rurality and which was also developed during the study. This training have to equip registered nurses with the knowledge to implement person-centered caring while managing the foot care of patients with diabetes. Areas that were addressed was caring, person-centeredness, which included person-centered communication, diabetic foot care prevention, which included glycemic control in terms of monitoring, diet, and general treatment, and foot care exercises, as well as medication. And then basic management of foot ulcers, onychomycosis, and the referral of these patients were also addressed. Then the recommendations is to evaluate how community care givers could assist in the foot care of patients with diabetes in these rural areas, to introduce point-of-care HbA1c monitoring in primary healthcare clinics to improve the glycemic control of the patients, and to evaluate how the media, such as a screen within the clinic with educational material, could assist the registered nurses with their limited time with appropriate health education in the primary healthcare clinics. And thank you for this opportunity to present, and here are my references. Thank you so much.